Welcome to Talking Back to Suicide. My name is Dr. Diane Kaufman, although I prefer to be called Diana for my creative self. And I'm a poet, artist, retired child psychiatrist, founder director of the Hold On campaign for suicide prevention that uses the power of art to educate, connect, express, and heal. And there's my co-host, Kino Isaac. Want to give a shout out, Kino?
Hey, good to be back once again.
Yes. And our special guest today is Natalia Orabeg, who is a board certified music therapist who specializes in medical neurologic music therapy, senior care, and end of life care. They were born and raised in Bogota, Colombia, and is a Portland, Oregon resident. And Natalia serves as president of the Oregon Association for Music Therapy. And we met at the National Association for Poetry Therapy conference, where Natalia facilitated the event's closing experience of our making percussive rhythmic sounds, spontaneity of vocal expression, and harmony to create community. And I'm so very pleased, Natalia, to welcome you to Talking Back to Suicide.
Thank you for having me, Diana. It's such a pleasure to be here with you and Kino. I'm excited to have this conversation.
Oh, great. Well, first, I'd like to know, how did you journey from Bogota, Colombia, to the Pacific Northwest?
Yeah, so, before we continue, I forgot to add that now I am the co-chair for the Government Relations Task Force. We're attempting to pass legislation to make music therapy covered by insurance, but we can talk a little bit more about that later.
Sure, thank you.
Yeah, so I've always loved music. I started playing violin when I was 7. And it was just such a big part of my life. And most of my friendships and my deep friendships that I still have were made through music. And so I knew when I graduated high school, I was a bit lost on what to do with the rest of my life and what to major in and what to do. And I knew that I wanted it to have music in some sort of capacity. And at the time, I was also very interested in psychology and helping people. That's always been kind of in my heart. Is I just want to help people, and if I could make that a career, then that would be great. So I started double majoring in music performance and psychology, and I was 3 semesters in when I had one of those terms. I had a really bad fight with my parents, a really bad fight with my at the time boyfriend. I was like super overloaded with classes. And so I decided I needed to take a little break and came to visit my aunt who lives in Canby, Oregon. And she was like, yeah, no, I'll host you over here for like a couple of months. You can clear your head and then, go back and continue. And so when I came over to visit her, I started taking violin lessons, because I wanted to continue, you have to keep your skills sharp when you want to be a performer. So I started studying violin with Sister Jeanette, who was a sister at Marylhurst University when it used to be around. And she told me that Marylhurst had an undergrad music therapy program. And that it clicked for me. It was like, wow, music and like psychology and helping people, that's what I want to do. So I talked to my parents and I was like, hey, this seems like a good opportunity. Can we make it happen? Thankfully, my parents were very supportive, and we all said, apply for I was here around March, and the next term started in August. So, my parents said like, well, go ahead, apply for a student visa. And if you get it before the term starts, apply for the university, everything. And, we'll see what happens. And if you get it this term, then you get it this term. And if not, we'll prepare for the next one. And the process was really fast for me. I got my visa super quick. They accepted me into the program, and I started that same fall of 2014. Yeah. and I studied at Marylhurst until it closed in 2018. Sadly, it was heartbreaking for a lot of us. But thankfully, Pacific University also has a music therapy program, so that's where I finished. Yeah, and that's how I became a music therapist. And then I ended up staying here in the Pacific Northwest. I met my husband, and I just stayed.
And in reading of you on your website and also the Music Therapy Association website, talked about neurologic music therapy. So could you explain to Kino and myself and our audience what is music therapy, and is there a specific branch around neurologic music therapy?
Yeah, thank you for that question. I'm so immersed in music therapy that I forget that other people don't know what it is. Music therapy, very generally defined, is the use of music in a therapeutic relationship to achieve clinical non-musical goals. So, in other words, we use music to help people achieve goals such as increasing self-esteem, learning coping skills. In my work as a medical music therapy, and I'll explain that the differences a little bit. I use it a lot for things like pain management, procedural support, help people go through procedures, especially procedures that are painful or uncomfortable. There's also a lot of work in NICU music therapy with the little babies in the neonatal intensive care units. And music therapy is, it's kind of hard to define because it has spread to work throughout the lifespan. So there's music therapists working in perinatal care with pregnant people and during birth, and there's people working, at the end of life spectrum, hospice and elder care, and everything in between. We are in substance use disorder groups, we are in hospitals, we are in mental health institutions, we are in schools, because music is such a intrinsic human experience, and everybody can use this tool for healing and connection. And so because we can work in so many different settings, there's different kind of approaches or streams of music therapy. In my schooling at Marylhurst, we were taught a very humanistic approach. It is an approach that is very holistic, taking the whole person into account. It is very kind of relationship driven. The goals tend to be more around personal growth, such as increasing self-esteem, increasing self-advocacy, that sort of thing. And later I ended up working in a hospital, and I got very interested in another stream of music therapy, which is medical music therapy. Now, medical music therapy is more focused on supporting goals that people have in the hospital so that they can discharge from the hospital. So, for example, a goal that we have very often is, or that I encounter very often with my patients, is they have gone through a procedure, like a surgery, and now they need to wean off a certain type of painkiller so that they can be discharged. So my goal as a music therapist is, obviously I can't fully get rid of their pain and I cannot cure anything, but there are a lot of ways to use music as a non-pharmacological pain management strategy. So using music and mindfulness, using body relaxation, using it as a distraction even. So my job is to teach people those skills and work on a plan so that they can discharge faster from the hospital and still have their pain controlled.
So you mentioned music helping with a person's sense of their self and raising self-esteem.
Mm-hmm.
How does music do that? Or what are the ways that you can utilize music?
Yeah, so I'm going to give a couple examples from the hospital. In the hospital setting, there's this very strange, anybody who has been hospitalized experiences this, where you are both somebody that feels incredibly cared for because the nurses are always there. You have your doctors, your PTs, OTs, medications, everything. And at the same time, you just feel kind of like a body somebody's taking care of. There's no place for you to express yourself. And you're kind of trapped in whatever the doctors say you have to do in the hospital and whatever the hospital can accommodate. It is an incredibly dehumanizing experience. So something as simple as somebody showing up and saying, hey, we're just going to talk about music today. What's your favorite song? It opens that window to like, oh, I am a person and I have likes, and I can bond with somebody over something that is not just my condition or my diagnoses. So it offers kind of that connection to the self that is so so strong and so powerful via either just even talking about your preferred music and sharing it with somebody else. I also try to get people to play music with me using small percussion instruments like egg shakers or drums that are very easy to play, so that people get to experience what it is like to be in synchrony with somebody else in rhythm. Something that I really like, and the basis kind of for neurologic music therapy, which I forgot to explain earlier, is that there was this big study done, I believe it was like 2018 or 2019, where they were trying to figure out which part of the brain developed first evolutionarily, right? What was the process of the brain evolving as we became Homo sapiens? And they discovered that the parts of the brain that understand and process rhythm and melody are older biologically than the parts that understand language. So our main communication for a while was musical and rhythmic. And if you think about it, every single culture in the world has instruments of some kind that have survived through the ages. So it also offers this very convenient, for me as a music therapist, window, like a back door into being able to connect with somebody, even if they're in a state of mind where we are not seeing the same reality. For example, with somebody with dementia, them and I are not seeing the same reality. They are perceiving things in a way that I do not understand and cannot see. And when I try to talk to them, I make no sense. However, I will sing "You Are My Sunshine," and they will sing it with me. In that moment, we have that shared sense of reality, and we can bond over that. We can get all the benefits of connecting as human people over something that we're sharing, even though we are so far apart in terms of what reality we're perceiving. And so that's another very powerful thing that music can give us.
I've read that music can help spark memory.
Yes.
Why is that? What is the neurologic basis of that?
We still don't know exactly why. That's one of the great mysteries of the brain that we haven't really been able to figure out. Some people theorize that it is because music as an experience is so encompassing of the whole brain. When we're listening to music and when we're making music, so many different parts of the brain activate, and that means that there's more connections created around a song that we know, including our motor cortex activates, our language parts of the brain activate, our emotional part of the brain activates. And so it makes sense that because of all those extra connections, music would be easier to recall than other types of memories, but we don't know yet. That's just one of the theories.
When you were speaking before about creating relationships and connection, I was thinking, has there ever been a drumming circle done at the UN? Right? Wouldn't that be like amazing, right? To do that.
Oh, that would be, I think that would help. Personally, I'm biased, obviously, because music is so important to me, but I do think there's something special about connecting over rhythm and connecting over, that shared space where you don't need to talk. You don't need to share an opinion. You're just being a part of the general sound. That's something that I've learned a lot about. I have been doing some drum circles with the Patricia Research Center for the Arts in Beaverton. And the first time I did it, I hadn't led a drum circle since I was in school. It was a long time ago. And I was very nervous that people weren't going to like it or weren't going to follow. And it was a pilot program. It was 4 sessions, one each weekend. And we started out with a group of 35 people. They didn't really know each other. I mean, some of them were friends, but most of them didn't know each other. And by the end of the 4 sessions, they had created a spreadsheet with like a bunch of people's phone numbers and emails so they could stay in touch over the summer. So it was such a powerful experience for them to just be in a drum circle, that they just had to keep connecting with one another outside of it. And that's really when I saw the deep power of it.
I'm thinking too that, of course, when we were all infants, right, the way that we were comforted when we were in distress and didn't have the language other than a cry, which is language, right, that it was through the rhythm, right, of being cradled and rocked, right? Yeah. And then what? Maybe even pressing up against the chest where the heart is, hearing the heartbeat.
Oh, hearing the heartbeat. Yeah, that's the primary rhythm for everybody, is the heartbeat.
And we have so many words with heart, right? Heartfelt.
Yes.
Right. Well, sadly, heartbreak too, right?
Yes.
But the heart being sensitive, the heart being courageous. Yeah. And then lullabies.
Yeah.
And then the music of nursery rhymes. Yeah, I'm very interested in poetry, and it's really it's the words, but it's also the rhythm of the words, which is creating a song.
Yeah, it has that same kind of musicality, even though it doesn't necessarily have a melody. It has a rhythm, it has a cadence, and that just our brains just love that. They love that so much.
And aren't there those mirror neurons? What I see you doing, right? If you started, I don't know, tapping your right hand in a certain way, that even unconsciously, I'm going to start doing that too, because of the mirror neurons.
Yeah, there is a fun term in music therapy called entrainment. And entrainment is exactly that. Is that if you are listening to a song, you will end up tapping your toe, moving your head, feeling or expressing that rhythm in your body in some way. Because again, our brains love rhythm. If our brains hear a rhythm, they're like, "Ooh, I want to attach myself to that." And is that we use it a lot to help people, for example, de-escalate from being really anxious or really agitated. So you start, you try to match where they're at. If they're going like at a super fast beat, you start kind of at that same beat. And once they kind of get attached to your rhythm, you start progressively slowing down, and they will follow. Because the brain is really good at kind of synchronizing with that and training, partly because of the mirror neurons. And you'll notice this too. Walking somewhere and you see a group of people, most likely they're all walking at the same speed. The steps are in synchrony because we want to entrain to one another. We want to keep that kind of sense of connection through rhythm and that sense of community through our body language and rhythm. It's really fun to notice.
Is it related to there being a sense of certainty?
What do you mean?
That the rhythm creates an expectation of what's coming next.
Yes. Yeah. And that's part of why. So in neurologic music therapy, I kind of forgot to explain a little bit about it. Neurologic music therapy is kind of an approach within medical music therapy that focuses specifically on the effects about neurologic music therapy, because it's all neural, cognitive stuff. So part of why our brains love rhythm so much is because it helps us predict more easily what's going to happen. If you have a beat going regularly, you know when the next beat is going to come. And that helps with rehabilitation because it helps the brain plan out the movements before you do them so that you can execute a movement easier. So for example, somebody with Parkinson's that has that shuffle walk, if you set a metronome with a specific match the steps to the beat, and it will help the brain say, okay, we're gonna lift our leg a little higher this time and make the steps bigger. And you also need some support with like how to physically move the body. But even just having the beat helps the brain coordinate all of those movements. It's also been proven in neurologic music therapy, although there's more studies that need to be done about this, that it helps with things like changing our mood states. Just having that kind of rhythm outside of ourselves that we can attach ourselves to that is safe and predictable can help us a lot when, de-escalating from an anxiety attack or when trying to do a grounding technique. Yeah.
Can you say more about that? How would you utilize music, or how can music help with emotions or understanding our emotions?
Yeah. So when, let me think about how to explain this. Because it is, emotions are so individual and so personal. So a song can mean very different things for very different people, depending on your life experience. If you have heard that song before, really, it's lyric analysis. So you'll hand out written lyrics of a song with a relevant theme. You listen to the song with your clients or your patients, and then you talk about the song. Now, if you're a good music therapist, you will choose a theme that your patients are struggling with or that you want to discuss with them. However, because initially you're just talking about the lyrics, it feels less vulnerable because they're not talking about themselves. They're talking about the character in this song, or the theme of the song, or even just the musical elements of that sense of safety of like, oh, actually maybe some of those things I'm experiencing, and that's okay. This is how it's playing out in this song. Is it how it's playing out in my life? And then you can kind of open that door a little more. Other ways are just using musical playing as an outlet for an emotion that maybe people are having a hard time describing. So, I don't know, with anger, for example, or grief. Grief is such a complex emotion, and sometimes words just don't describe it. But you sing a song with a person and tell them, hey, play your anger out on this drum, and I will musically support you. I will musically accompany you. It's much easier for them to just let their body express that emotion through an instrument, and feeling that containment from the music therapist holding the music.
As you were speaking, I was thinking, is there ever like family music therapy?
Yep.
Could you say something about that? I was triggered to think that when you were talking about supporting the person, right? And of course, there's family therapy, but there's also family music therapy.
Yes, I know that some music therapists do focus also on treating families. I don't have as much experience with it, but I'll give you an example that I learned from when I was in school. One of our professors was giving this example of like, how would you use this in like couples therapy, right? With a couple. And the example she gave was like, okay, you give each one of them a drum, right? So one of them initiates, the other one, you're following kind of verbal conversation rules, but by playing on the drum. And very quickly, you will start seeing the same patterns of like communication verbally on the drums that you see them have. And because they're playing the drums and it sounds kind of silly, they also will be a little more relaxed and maybe also notice those patterns. So when you have a drum, because it's very loud. But at the same time, because you're not saying words, you're not putting like a specific content that may be emotionally triggering, or that, they're not replaying the same fight, for example. They're just playing drums. It's a little easier to approach than a conversation of like, well, I noticed this in the music. Again, this has nothing to do with like who did what, whose fault is what. It's everything to do with the music that they were playing. And that makes it a little less vulnerable and creates that sense of safety of like, okay, we're talking about this thing kind of around it, but at the same time, we're pointing out these specific patterns. And I always thought that was genius. That was, I don't know. I've been wanting to do that, but I don't work with couples. So we'll see. One day I'll get a chance.
Now, could you say something about adults, right? About depression, loneliness, perhaps suicidal thoughts. Just recently, I'm not sure if I'm going to quote the statistic correctly, but something like the risk of being like the impact of loneliness, right? I think they're talking about seniors, could be the same as smoking 17 cigarettes per day.
Yeah, I just like anecdotally, I can confirm. One of my first jobs when I graduated was working at a geriatric psych unit. So it's a psychiatric, acute psychiatric unit for adults 62 and up. And a lot of the adults that ended up in the psych unit were there because of depression, because of isolation, and because of suicide attempts. In most of the cases, it was because their spouse had recently passed away. So there was then, not just the emotional vacuum of that person leaving your life, the grief, but also they couldn't afford to live by themselves anymore, or the spouse was the one that maintained the home and they have a disability or something that prevents them taking care of themselves, and they have nobody else to take care of them. So they end up in the hospital cycle. Yeah. And a lot of it is because of isolation and because of this stigma on aging. A lot of them, sadly, when I would talk to them about, trying to like turn it around and think of things that they can look forward to in their lives, they were like, well, I'm old. I don't have anything to look forward to and nobody cares about me. So what's the point? And that was always so heartbreaking to hear. Because of course, I in my heart see the value. You have a society that kind of shuns older adults, and when they stop being quote unquote profitable or of service to others, then they just kind of get shoved in this corner and forgotten about. That puts a lot of stress on a person, and that creates a lot of self-identity problems, leads to depression, and sadly, a lot of them, the only way that they see is attempting suicide.
When you came as what, a older teenager, right, to the Pacific Northwest, what that you noticed? Yeah.
Yes.
Could you say something about that between your country of origin, Colombia, and here, the USA?
Yes. I came here as a 20-year-old, so yeah, a young adult. And yes, the cultural shock was bigger than I expected. Because in Colombia, we're very collectivist, right? So we're not individualists. We're like the center of our lives. Growing up, for example, I would go to my grandparents' house every weekend, and all of my aunts and uncles were there, and all my cousins were there, and we would just have lunch all together. hang out for the afternoon, and then, go on our merry way. But that was every weekend of my life. And it was kind of weird to find families that didn't do that, or that didn't see each other every week or every other week. It is also very intrinsic to our culture that when a parent ages, they move in with us. So they're still taken care of. We make sure that they stay with us, that we can take care of them. Move their elder parent to a facility unless it is medically necessary. For example, with dementia, there arrives a time where it is very difficult to care for them and maintain safety without a lot of extra support. So in those cases, they do make the decision to move them to another place. But we mostly have multi-generational homes. And so when I moved here, that was a big shock to see that, I would ask my friends about their families, and they were like, oh yeah, they're in the East Coast. I haven't seen them in years. It's like, wow, that's just mind-blowing to me. And also the way in which people relate to one another. This is something that my husband and I have talked about extensively. Because the first time he came to Colombia, it was around my birthday. So of course my parents, invited my whole family, which is 50 people, plus my friends to celebrate. And first of all, he was surprised because obviously for me, I told him yeah, it's just my close family, 50 people. So he was a shock for him. He's American, yes. But then he was also surprised by the way in which my friends acted towards him, because they were going out of their way to include him in whatever they were doing, even though for some of the time didn't speak Spanish. So there was a barrier there, and yet they still did everything they could to make him feel included. Whereas here, if you're new to a group of people, you kind of have to make your way into the group of people. They're not going to intrinsically just invite you in and make you a part of the group. So that's also a very different way of understanding relationships. And that was, it was a big cultural shock for me, especially trying to make friends and not understanding what was going on. I thought people didn't like me for a long time.
When you said that about being part of the group, like a light bulb went off, or maybe I should say a bell went off in my head, right? About that the music itself helps you become part of the group.
Yeah.
The music is doing the work.
Exactly. Yes, the music is doing the work. You're just there to, as a facilitator, you're just there to make sure that the music is containing and feel safe. Because there's freedom within structure, right? So you have to set up a structure of a group so that people feel free interacting with one another and knowing what's going on. When you have a too free a structure, people get nervous and they don't want to jump in and take risks musically.
Do you know, Natalia, the statistics on suicide in older individuals?
Yes, I was looking it up. I think from the CDC, the most updated one is for people aged, they account for 23% of suicide deaths. So it's higher than average. Most suicide attempts are done by men more than women, which also anecdotally totally makes sense. I think also because women, and I have noticed in the United States, men tend to be very lonely, and they only kind of trust emotionally their partners or their spouses. Whereas women, tend to have a bigger group of friends, or they tend to have deeper relationships with when, if a woman is married to a man and the man dies, she still has kind of a support network. She still has friends and other family members that she has built these relationships with, whereas men don't necessarily have that. But yeah, that's it's, yeah, I read that statistic. It just blew my mind.
Kino, I know you are a musician and very into music professionally and personally, and also a mental health advocate for independent artists. So, what are your questions or comments?
So many, you know, I was enjoying myself just sitting back, relaxing.
Yeah, I was wondering when the keynote questions were coming.
Like I was watching a movie, you know, I just needed the popcorn. You know, when you were talking about, you know, music, or you use the word communication to express our feelings, I had like this reminiscing thought, you know, when you were in school and you liked someone, you know, whether it was a girl or a boy, and you didn't know how to express yourself verbally, you know, those days, the CD era, you know, you'll burn a CD and you'll give it to that person to express your feelings with a bunch of love songs on it.
Yes.
You know, I'm guilty of that as well. You know, I recall also doing that. You know, it was just how it was. You could use music to express how you were really feeling, you know, as it was done back in those days. And then in 2006, when Spotify was born, you know, then you would send a song now to a person and you would tell them, you know, listen to the song. So yeah, I was having that reminiscing thought, you know, how music is so important to communicate with each other when you just don't have the right words to tell that person. Natalia, my first question I want to ask is when we talk about music, you know, there's different types of music, there's different genres of music, there's different frequency levels of music. When it comes to music therapy, does frequency play a role, you know, depending on the individual? Like, for example, 432 hertz or over 400 hertz, you know, you're in a good position, you know, for your own well-being if you're listening to that type of frequency. So, like, what types of, you know, frequencies do you use? Do you like use specific frequencies, you know, depending on the person? How does that play a role?
Yeah, that's it's an interesting question, because what all the research in music therapy has shown is that the music that is going to be most effective to you is music that is personally meaningful. Especially music that you listen to like in your teenage years, early adulthood. So I try to like calculate, okay, if they were born, I don't know, in the 40s, then this is when they would have been 20. This is kind of the music that was on the radio, and that's the music I aim for. And it's effective all the time. So more than a specific song for a specific purpose or a specific frequency for a specific purpose, it's like, now for certain things you can use, you know, you try to use like more calm music or instrumental even, or like actual songs. Then you have to be careful about copyright, of course, but that's a different story. But yeah, in general, you try to find like the music that is meaningful to that person. For some people specifically, for example, if they have autism or any sort of sensory processing disorder, you do have to be very careful with what kinds of instruments you bring in, because it can be too overwhelming for their senses, or too underwhelming. So maybe there's some autistic kids that I've worked with that you need the noise to be like up here for them to like activate their sensory systems and be able to like fully participate and be kind of sensorily activated enough. For some kids, it needs to be way down here. It's a little bit of both, but mostly you have to learn what that person's music looks like.
And what's that process, you know, to learn what's that person's music well? Like, what does it look like?
Yeah, that's actually one of my favorite parts of starting my first sessions with any patient are always, okay, let's just talk about the music you like. And we'll do a song sharing. Sometimes, I'll look it up online if I don't know the song. We'll listen to it. I'll ask them what they like about the song. Is there any other songs that you can think of that you like? I start kind of collecting playlists. And if I can, I learn songs that are special to them. Whenever that's not a possibility, like if a person has dementia and cannot remember specific songs or specific genres, I will try to calculate, when were they in their 20s? What kind of music was playing on the radio at that time? And I'll just try playing songs and seeing which one gets a reaction and what kind of reaction.
Yeah.
A song that I always use is Country Roads by John Denver. Everybody knows that song. Who that person is musically, because it can be quite polarizing. You wouldn't think so, but it can be. For the people that absolutely do not like country or western, I'll play that song and they'll be like, yeah, no. So I'll be like, okay, let's try more classic rock and see where we do with that, or like earlier funk or hip hop or whatever other genres, right? But that's for the person to tell me what music they like. Another funny experience is working with younger adults and teenagers. Because usually during my intake process, if it's through my private practice, part of my intake process is asking, what is your preferred kind of music? What music would you like me to not bring into session? We also have to remember that music can be harmful and people can have negative memories attached to a song that we don't really need to bring into session, at least in the beginning, right? So I ask the parents, and sometimes the parents will be like, oh, she likes Hannah Montana and whatever. And then I'll be in session with Billie Eilish or whatever else. So then you see that, like, okay, these teenagers is using music to kind of rebel a little bit. And that's kind of where they're at. And that's where the music is at. So it's very fun to also see those situations happen.
Yeah. Thinking a few weeks ago, I was actually standing on the road and I was actually singing Country Roads.
I like that song. It's a good song.
Yeah, it sticks, it sticks. Okay. Yeah, thanks for explaining that. When you were mentioning about using music as a distraction, is that healthy? Let me use this example. Some people will consume alcohol or drugs as a distraction from my reality. Is that healthy? Is it like taking me away from issues at the moment in my life?
Yeah, that's an excellent question. I would say it really depends how you're using it. For example, if distraction, as a music therapist, I'm with a patient in the hospital and they're getting their dressings changed for a wound. That can be incredibly painful. And sometimes the only thing that works is to distract that person from what's happening with their wound care via songs, via music. So we'll do like a karaoke party, quote unquote, right? I will try to wound so that they can't see it, or just have them like look away. And I just try my best to be engaging and entertaining and find songs that they like and that they can connect with, that are also kind of fill that emotional intensity. Because our brains can only focus on so much at a given point. It is a lie that we can multitask. Our brain can focus on one thing at a time, and it's very good at switching tasks. But if you engage the brain enough in an activity, it will stop paying attention to the pain. And in those cases, distraction is really helpful because it helps them get through this wound care. It also helps the nurses with doing the process faster because they also don't have the emotional component of knowing that this person is in pain, which is incredibly stressful for them as well. So if it can happen faster, they can sometimes they join in singing. during the sessions, because it also relieves stress for them during the procedures. Now, there's also that side of music that you were talking about, where you can use it to either ignore things that you should really be working on in your life, or music has also played this role in that is negative. So music can also be an instigator of bad behavior. This is something that music therapists that work in substance use have to be very mindful of, because if they bring a song that somebody listens to often when they're using, that can be a trigger for that person to want to have cravings or to like regress in the process. Substance use disorders, music therapy, but I can imagine how at some point in their journey you can take those songs and explore what the meaning was during that time for them. So why was this song so important to you when you were using, and what, you know, what has changed, and maybe what things can we take from this into your healing journey? Yeah, but as with everything, music can be harmful. Yeah.
Yeah. No, thank you for explaining, you know, the distraction on both sides of the fence. How you utilizing it is actually healthy distraction. It's like going to a tattoo parlor. You know, they will have this on to distract you from the pain. So thank you for explaining both sides of it from your reality, which is so dangerous as well in this day and age because of algorithms. Because the moment you put on a song which is depressing, you know, the next song straight after that is going to be just as depressing, and that could lead, you know, to a lot of suicidal.
It can create that feedback loop.
Yeah,
and it's also with the concept of entrainment. That's also something that is very important. If a patient that is in a very depressed mood, let's say they just arrived at the hospital after surviving a suicide attempt, right? They're in that stage, being in, you know, seeing, being so depressed and having just done that and having survived. There's so many emotions that can be going on, and at the same time, they can be feeling very numb. The only music that they're gonna feel connected to is music that is kind of on that same wavelength. You know, put in a more like approachable manner. When you're angry, you don't want to hear Enya. You don't want to hear calm music, right? You want to hear angry music, because we want to match with we want our external reality to match our internal reality. So if I go to a depressed person and sing, it's not going to connect at all, and it may even make them more depressed. So you have to be very gentle, and again, get to know what their music looks like at that time. Get to know, okay, these are the songs that we're living in right now. And sometimes they do want to explore those themes right away. Sometimes they feel like they need to talk about it, but they don't necessarily know how. And that's when the music can bring in that bridge. Because we're talking about these songs specifically, we're not talking about you. We're not talking about me, we're talking about the song.
Yeah.
And then slowly you can start kind of bringing it back. Do you see yourself in this song? And start exploring their emotions from there. And slowly, you know, again, with entrainment, slowly you can bring up the mood, introduce new emotions, introduce new ideas. There's so many, especially like, I was surprised by this, but a lot of like punk and emo and pop punk songs that are about resilience, but also talk about why you have to be resilient, because you have been in this very negative place, right? So it's a little bit of both, like how you can be experiencing all this internal pain and at the same time have hope for the future.
Yeah.
Which is incredibly powerful to hear in a moment like that. Yeah.
Yeah.
Like
Someone makes
dialectical.
you angry, put on TikTok.
I was going to say,
What was that? Yeah.
What you just said, Natalia, summarizes DBT, dialectical behavioral therapy, in a nutshell, right? That it's not one or the other; it can be both at the same time.
Yeah.
Right?
And it's more
just because you're in pain, and that's, we're not diminishing that. That's real and
yeah,
deeply
exactly.
painful, obviously, but that also does not mean there is not also hope, right? For the future, and hope for the present too. It's not one or the other, it's and.
Yeah, exactly. It's more about the internal process that is going on, and accepting where you're at, and learning to see those emotions and explore them. And music is a great tool for that.
I'm going to ask, I don't know, maybe it's a little bit of an offbeat, pardon the pun, right? Question. I'm just thinking that there have been, and again, suicide is across all ages, ethnicities, faiths, etc. And there have been suicide amongst individuals who are musicians, right? Famous musicians who loved their craft and are known to millions of their fans, right? And even not their fans know them. Do you have any thoughts about that in terms of, in any way you want to take it, but just someone whose life is immersed in music, and yet the music alone, right? Perhaps, quote, wasn't enough. Of course, one thing is never enough. We need many things going on in our life, and also potentially what that means to their fans, right? That I love you, I respect you, you brought joy into my life, and like, what happened,
Yeah.
to that person?
Yeah, that's interesting. I hadn't really thought of that in those terms. I don't know. I don't know the statistics of musicians and the suicide rates for musicians. I can see how, as a musician, especially if you're in that state of mind, you can just keep kind of spiraling down through your music, kind of like what we were talking about with Kino earlier, where music becomes in itself kind of destructive because it just keeps you in that mood, and it keeps escalating in its presentation. I know, sometimes it's also like you are a certain kind of musician, and especially the ones that become really famous feel like they kind of lost their art, because then they're so beholden to what fans want that they don't get. And then, there may be, as you said, 1,000 other reasons. Music can be as great a tool to kind of get you out of that rut as it is to dig you in. Yeah.
Do you have any thoughts, Kino, on that?
Yeah. I was going to say, let me jump in just to answer your question. There's also a lot of pressure that comes with being at that level in the music industry.
Yeah.
There's a lot of pressure that comes with it. You have to keep in mind that when we look at, I'm going to use someone recent like Avicii, for example, 95% of your life you are traveling or you're in the studio. Substance abuse plays a huge role, whichever musician you look back, even Whitney Houston, for example. So you have to, the fans have to understand that I've been traveling for 95% of my life, the entire year. I rarely see my family. I don't have a social life. Yeah, things may look great for me, on paper. I'm performing all around the world. Where I'm not performing, I'm in the studio. Even if I'm in a different country, I'm in studio. There's a lot of expectations from me to please the fans. Let's use Justin Bieber as an example. When he canceled his tour because he couldn't handle it psychologically, the pressure was getting to him. Fortunate enough, he made that decision. He made a good call for his life to say, look, guys, I'm canceling my tour. I can't handle it. It's too much for me. He went back home. Some don't. Avicii, alcohol, how do you pronounce it? Something like that. But, using alcohol, okay, Whitney Houston, drug abuse.
Yeah.
So the pressure does get to you being in the music industry and being in the limelight all the time. Sooner or later, it does. And then there's like no way out besides suicide.
Or they
Sometimes,
think there's no way out.
Yeah, in their minds, that's the only way out.
but sometimes it's not even like planned suicide, right? I mean, Whitney Houston was found in a bathtub. It was an overdose.
Yes.
She probably didn't even realize at that time, look, I'm taking too much.
Yeah.
And she did. And then the result was death. And then they will label it suicide. But at the time, who knows?
Yeah.
Yeah.
That is so true. The pressure, I hadn't thought of that, but it's true. When I was studying performance, it's the pressure is that you work on this piece of music for the whole semester, and it all comes down to, can you perform it in front of a jury of people that are listening to every note you play and being critical, because that's their job, right? They're there to like jury how you're doing and give you a grade. And if you play the wrong thing, or you didn't sleep well the night before and you just flunk it, that's your grade. That's all of the effort kind of destroyed in that moment. It's a lot of pressure.
And
I can imagine that times a million when you're performing in front of people, or when you're trying to get a label contract.
Yeah.
Or when you're trying to go on your first tour.
There's such an expectation from you, and I can also talk from personal experiences, starting off my career as a DJ in clubs. There's a specific music festivals, for example. This is based on research. There's actually a book I'm reading about this, this present moment in time. If I'm a performer and I'm going on stage, let's just say Tomorrowland or Ultra, for example, keep in mind, my audience are people that are high on drugs, they boozed up. So I need to be on their same level. So for me as a DJ now, I also need now to fulfill their expectations, because that's what I am getting paid to do. Even if I don't want to do it as a musician, my manager is going to insist that I do it. The record labels are going to insist that I do it. This is the dark side of the music industry. So the artist deals with that pressure as well. It's not in the mainstream media, mainstream news, but this is the dark side of the music industry. At times, the newspapers will be quick to judge the artist. Oh yeah, he's a drug addict. But not knowing that it's also the record label and that artist's management team that has pushed that artist to consume drugs, consume alcohol, to be on the same level as the crowd, because you need to perform. Also, when it comes to just being an author or being a writer, proven by stats as well. If you're a non-fiction writer, you are more likely to have suicidal thoughts. When you're a fiction writer, you are more likely to be depressed. And these are things we are still trying to figure out, the why. Why does it happen? So, but I mean, keeping it to music and why it leads to suicide and suicidal thoughts and depression, that pressure, once again, it's a fact. Performers need to be on some sort of substance, to be at
or just to keep up with the rhythm of the music industry, because you have to crank out albums, and you have to you're traveling overnight, and then the next day you have a show, and then immediately after the show you're going away again. You have to find, I guess substances end up being the crutch that keeps you going through the tour.
Exactly.
How does a person cope, the musician, with almost like the crash after the high of the performance? Or you're in front of a giant audience, and now they've all gone, and it's just you alone, and that high is over.
Yeah.
Can music, as a music therapist, right? What would you quote prescribe, right,
My
for us
yeah.
in terms of sustaining us in a healthy way? And although this is also very different to sustain ourselves through music, because all the work that you're doing as a music therapist in the hospital with that depressed or patient with dementia is helping them, but then they're discharged, right? And how can music therapy or music itself, right, be used in a healing way for their daily life?
Yeah. Do you mean, well, I'm going to talk from my personal kind of little music therapy things that I do for myself, and then for more generally. I started developing this and realizing how important it is when I started working in hospice care. Because I had never, my training was not really in hospice care. I never went to any practicum sites. I never had like supervised sessions where I was facilitating hospice sessions. So it was a big shock therapist during a hospice session. And then when your patients pass away, I was with a lot of them that I didn't see them pass away in front of me, but I was within minutes or within hours of the end of their lives. So I started out with journaling a lot. I would keep a journal in my car, and right after sessions, I would just take 10 minutes to just journal and cry if I needed to, because it's very intense. And then I realized that I was using so much music for my job that music in itself felt like a chore and felt like a job to me. And that was very scary, to feel like I didn't have that kind. I feel like a lot of music therapists end up doing this. There's just specific types of music that I never use for patients. For example, my violin is for me. I don't bring it to sessions. That's my instrument, and it stays there because I need it to. I need to have that part of my music untouched by work. If I were the music therapist for a touring musician that is crashing out after concerts, I would suggest something similar. I would say not necessarily creating your own music, but find music that touches that emotion when you're not, when you're after the shows, that allows you to have that kind of vulnerability, but without spiraling you down, right? So something that keeps you positive and that nobody else has to know about. It is your music and you use it for you. Or creating specific kind of music that your fans will never like, but you like it. That's also very valuable because you're doing it for yourself. Nobody else has to see it. I'm sure that there's something similar with poetry therapy where you just write for yourself and nobody has to ever see it because it's just for you. And that in itself can be very freeing and help in those moments.
I could imagine too that supports the the structure of the self, right?
Mm-hmm.
Instead of the self, I don't know, like disappearing, or a sense that who you are, or that intensity, now you're evaporating, right?
Yeah. You need kind of that anchor.
Yeah, that
outside of yourself that is keeping you. Yeah.
For yourself, it reminds you of, I have a self, and I can create that and feel it again and nourish it.
Yeah. And I am important outside of my job, outside of how many people like my posts, outside of how many people showed up to my show. I think that's also really important because when you're a musician, that becomes the measure of your value is, okay, how many CDs have I sold? How many people have watched my YouTube video? Oh no, we lost Kino.
Yeah, I know. But hopefully he's going to come back again.
Okay.
We'll just keep talking a little bit longer.
We'll just keep talking.
Right. Yeah, so
Anyways,
say
yes,
more
that
about that.
kind of becomes the measure of your value as a person, and so you need something outside of that to still feel important and to still feel like, you know, like an individual human being that exists in the world.
And I think that's maybe like a counterbalance to that feeling of feeling lost.
Mm-hmm. Yeah, and for my patients, sometimes I will create playlists with them that they can take with them outside of the hospital. Now, will they listen to them? I don't know. All I can do is help them create a playlist that makes sense, especially for pain management. Sometimes I record one of our relaxation sessions in the hospital. I usually use like a script for guided relaxation while I play gentle music, and so I will record that for them so that they can then use it outside of the hospital. Some have said that they find it valuable. Again, I don't know if they actually use it, but you know, that's a way in which you can use music.
Natalia, do you work with your patients, clients, for them to create their own music and songs? Is there any songwriting as part of sessions? Could you say something about that?
Yeah. Songwriting is very exciting when you get to do it, because it's like the ultimate expression of your musicality, right, and of yourself, and it's just such an accomplishment when you write a song. With a lot of them, I will start with tinier things like fill in the blank. So I'll take an existing song and then change up. It is not necessarily indicated for everybody. Some people will have no interest in songwriting. For some people, it will be just too confusing or too cognitively complex. But for those that have, you know, that want to engage with it, we can start, you know, tiny with the fill in the blanks, and then you kind of take away more recorded elements of it. So, for example, you will then go to like change a whole verse of a song. You will then move to create lyrics for a song with music from an existing song, but you're changing the whole lyrics, and then you get to the point of creating the whole music. Now, this one is tricky. Sometimes, if they are not musicians themselves, I just have to kind of give them options of things that I can play, which can be a little limiting. If they are musicians themselves, then that's even better, because then they can bring their music to me and I can help them structure it in a way that will lead to a song. Now, this has very rarely happened to me. I've only encountered one musician in my clinical practice that wanted to write a song with me and that had the skills to like make his own music through this process. But it's always very exciting, especially when you know that they've been struggling a lot with self-expression or with self-love, especially, to see that their song works, or to see that their verse sounds good, or to hear their verse sung by me and feel it in their heart, be like, wow, yes,
and
that's what I wanted to.
Sometimes what spontaneously will say, we love it. Right?
Yes, that's how it starts when we're working on whole verses or whole lyrics. Is we will set a topic, right? Whatever it is that we're working on, and then I'll just let them talk about it. I'll just say, talk about it, tell me more about it, and I'll take notes and I'll catch like quotes or little phrases or ideas, and then slowly we start morphing that into a verse. And once they hear the verse fully completed and have given it their okay, I just, the sense of joy that you see them experience is amazing, because it's such an accomplishment.
Yes. Yeah, I had an experience with that. It goes back very many years ago. but I had been volunteering in Newark, New Jersey at an alcohol and drug rehabilitation program, residential program, Integrity House. And I had, for the residents, created a poetry self-help book. And it was called Cracking Up and Back Again, Transformation Through Poetry. And there were personal poems. All of them were my own personal poems, but I felt they had universal themes. And I accompanied it with a writing prompt. And we did this series of 15 poems very successfully at the program. And then a while later, I met a professor of music therapy, Karen Goodman, from Montclair University. And she had an idea for a community project. And I must have told her about the workbook I had done. And she invited her students to come with me to Integrity House and met with a group of women where we looked at the poetry, and then they were writing their own poems inspired by what they read. And the music therapy interns would help them transform it into music. It was so
Oh, that sounds like such an amazing experience.
It was so powerful and so enjoyable. Even, I mean, it almost seems paradoxical. Like, how can you enjoy talking about your pain? And yet, maybe you could speak on that. And yet, there was such a sense of fulfillment of getting the words out and getting the, like, that is the exact way that it sounds to me. Could you speak on that?
Yeah, I think it's just the experience of feeling like you finally got to express it, fully, and to see it expressed in a way that makes sense to you and that other people can connect to. And also knowing that, you worked hard to get there and you achieved it. It's like a combination of a sense of accomplishment and a sense of recognition. I think that's,
I think so too. And then if one wants to share what they did, which in a group setting, I mean, you would always ask, do you want to share? But very many people do want to share. That it's that sense that I've contributed something.
Yeah. And that sense of, other people witnessing your growth and witnessing what it is that you're bringing to the table and accepting it. Or embracing it, at least, at least witnessing it, but even better if they can embrace it, because then that's just so validating in itself.
So I know that Kino must be having internet troubles in South Africa. Right? Do you, Natalia, do you have any final words that you'd like to say if there's someone who's in the audience that might be struggling with their mental health? Something that you'd like to say about hope and music therapy and how they can learn more about you and music therapy in general?
Yeah, so first that, they're not alone. And in the moment, it can be really hard to see it, but there is help out there. I would also say use music to try to find the parts of you that you're proud of, that you like. Going back to music that you listened to when you were younger is a great way to do that, because it reminds you of like these things that you were starting to explore your independence with, and maybe that can spark a little bit of that that sense of self again. And if you can, work with a music therapist if you're interested. You can find a lot of us on the Oregon Association for Music Therapy website. There is a little link there that is Find a Music Therapist. It will link you up with one of our many, many good professionals.
And outside of Oregon, nationally or internationally, how would people find out about it?
Yeah, so nationally, we have the American Music Therapy Association website. There's also, I think, a link in that website. I know some parts of it, the website are under repair right now, but they also have a list of all the national certified music therapists. Or they can go to the Board Certification for Music Therapists website. Those are all the music therapists that have passed their board certification and are currently practicing. And then to find me specifically, I also have a website for my private practice. It's uribemusictherapy.com. That is URIBE. That's B as in boy. Musictherapy.com.
Excellent. Very good.
Yeah.
Well, Natalia, I am so glad for our conversation today, and so glad that we met each other, right? Just a number of months ago, right, at the National Association. So for Poetry Therapy. So Kino is back, right?
Hi, Kino.
Yeah.
Yeah, like I said at the start,
we were,
when you were kicked out, like, internet today,
yeah,
it's terrible.
We were
Nobody-
just saying goodbye to each other, and Natalia was giving information about how to find a music therapist in Oregon and nationally, and her website about mental health. You're not alone, right? Music therapy may be of help to you. Could you want to share your goodbye to Natalia?
Yeah, no, two things. I just wanted to also elaborate more when you were asking the question about what does a musician do, when the hype is over. And once again, this is coming from experience because I was born in that world. That's where I'm coming from. Hence why I wanted to focus on the psychology and mental illness within the music industry itself. Once that hype is over and you're an artist that is consuming whether it be drugs or whether it be alcohol, you are depressed, and the depression is terrible, and I'm open about my life and my career and where I started. I've been there, I've experienced it. When you are alone sitting, once the hype is over and done with, the next morning you are depressed. Depressed to a state where you're actually crying. I'm fortunate enough that I've never had suicidal thoughts, but what I used to do in those moments is I used to pick up the phone and I used to call my mother. And I'll be like, this is how I'm feeling right now. I won't go into details, but just talking to her would help a bit. Being around people, maybe calling friends who are closest to you, hey, let's meet up, just to chill out. That sort of helped me, So if anyone ever finds themselves in that situation, that's what you do. For any listeners or maybe musicians who find themselves in that situations. But one advice I can give to any musician listening to the show is don't get peer pressured. It does happen. It can happen. It will happen. Do your best to be mentally strong because, it's not worth it. Can be disastrous. Natalia, like the work you do, like I am definitely going to be checking out your website. Like, do you just work like in the States, or do you have like global network? Do you interact with people globally when it comes to music therapy?
I don't specifically, but there is the World Federation for Music Therapy is another good place to go check out. Their journals are free access. So if you want to read music therapy journals, go to the World Federation for Music Therapy website. There's a lot of good articles, a lot of good books, a lot of good information. So that's kind of my connection. And then the Neurologic Music Therapy Academy is actually based in Canada. So sometimes I go to their support meetings and, we discuss specific cases and seek support and talk about what it's like to be a music therapist. That's the other thing that I wanted to mention. So thank you for that, Kino. Sadly, music therapy is not currently covered by insurance in Oregon. We are in the process of figuring out how to change that. It looks like we will have to pass some legislation. So if you want to support this effort, you can also send me an email and I will give you some steps on how you can support music therapists in achieving this. It's also that we can serve a wider base of people, because right now it's mostly either grants, private pay, or if a facility wants to pay us on behalf of the patients. So you can imagine how access is not very widespread for the people that need it the most. Yeah, so we're working hard on it. It will come. It will take some years, but it will be here.
Natalia,
keep us in the loop.
do send me an email about that in terms of how to help, because I could do some social media posts with the
Oh,
whole
that would be so helpful. Yes, I will send you some information on it. Yeah, thank you.
Yeah. And also
Okay.
forward it to me, Anna, when you get it.
Yes, I will.
Yeah.
Thank you again, Natalia.
Thanks
Yeah,
so
thank you
much.
both so much. It was great to meet you, Kino. It was great to see you again, Diana.
Yes.
All right.
All right.
Bye.
Bye. Have a good day.